चलिए आगे बढ़ते हैं, रुख कर लेते हैं दक्षिणी भारत का और खबर है बेंगलुरु से, जहां पर कोरोना की बेकाबू हो चुकी रफ्तार का और भी ज़्यादा तेज़ी से बढ़ना जारी है। और अगर टेस्टिंग के आंकड़ों की यहां पर बात की जाए तो अप्रैल और मई महीनों के बीच करीब 24% कोरोना टेस्टिंग में गिरावट दर्ज की गई है। बेंगलुरु नगर पालिका के कमिश्नर गौरव गुप्ता का कहना है कि लॉकडाउन के चलते कम लोग टेस्टिंग के लिए आ रहे हैं। इसके साथ ही साथ ये भी बात कही गई है कि उन्होंने ये भी कहा कि बेंगलुरु में पर्याप्त टेस्टिंग किट्स मौजूद हैं और यहां पर टेस्टिंग को बढ़ाया जा रहा है। बीते 24 घंटों की अगर बात की जाए तो बेंगलुरु में 35.56% से 13,000 से ज्यादा कोविड के नए मामले सामने आए हैं।
We used to do about 1 lakh testing per day. Now it's only around 30,000 testing per day. So this can give a false impression of that the cases are coming down because the positivity rate is still 28 to 30%. So unless we do more number of testings, the real number of positive cases will not come out. So we should not be in a false impression that the number of cases in Bengaluru is coming down.
चलिए सीधा चलते हैं श्रीजा के पास, जो कि और ज्यादा जानकारी देंगे इस बड़ी खबर पर। श्रीजा, गुड मॉर्निंग। फर्स्ट ऑफ ऑल, very alarming trend there from Bengaluru. On one hand, we are seeing a staggering rise in COVID cases, and on the other hand, there is almost 24% drop in testing in a month between April and May. If you can just put these numbers in perspective as to how it is playing out in the current situation of Bengaluru.
Well, as Dr. Prasanna suggested, saying that Bengaluru was testing at least about 1 lakh to 1.2 lakh. So on the whole, we understand Karnataka has a lab capacity for testing at least about 1.6 to 1.8. Now, this varies on a daily basis, but now, very shockingly, we understand that the city that was usually testing at least 1 lakh to 1.2 has considerably, today, if you're looking at, as on yesterday, last evening, we are looking at a testing of just about 30 to 35,000. So really, there's a huge stark difference from the what that we saw from the starting of April till about now, and just within a period of a maximum 15 to 20 days, the testing has drastically come down. What's also important to understand, the irony that we're looking here is the city of Bengaluru is the epicenter of the pandemic here. The city contributes the maximum number of cases along with the maximum number of deaths. Now, having said that, we understand that the nodal officers who are supposed to be, in fact, immediately ensuring that to increase and ramp up the testing, we are looking at over a period of 20 days for reasons unknown. For logic reasons unknown, we understand that they have brought down the testing. Of course, we reached out to the BBMP, and the answers given to us on why exactly the testing was lowered. They tell us that it's only because it's due to lockdown period. There are people who are following the COVID behavior. They are at home, and that is also one of the reasons. But remember, it's also important to understand that testing, the number of people testing and the number of people turning out to be positive is much lesser, which means, just like Dr. Prasanna also pointed out, if you increase the number of testing, you will also know the number of people who are also going to test positive. Now, this gives a rise to super spreaders, which we understand. Speaking to the BBMP has also told us that they will be notifying the nodal officers to ramp up the testing as soon as possible.
Right. Thank you, Sreeja, for sharing all those details from the city of Bengaluru.